Hey everyone, my name is Stephen Condon, and for my journal review, I chose an article that examined the effect of LSVT big therapy on stage 1 Parkinson's disease patients. Just a quick review of what PD is. It is a progressive disorder of the nervous system that affects movement, speech, and cognitive behavior. It presents as bradykinesia, resting tremor, rigidity of muscles, impaired posture, and speech changes. Typically, it'll affect men more than women who are around the age of 60 or older. Currently, there are about 1.5 million Americans who have been diagnosed and are living with PD. And of those 1.5 million cases, 85 to 90% are classified as idiopathic. That is astounding considering the amount of people diagnosed with PD that the cause is still unknown. As you can see on the right, I've added the Hone and Yar scale, which classifies the different stages of PD from stage 1 to stage 5, which is the most severe. And on the far right is a newer, more modified scale, which some are using that adds a stage 1.5 and 2.5. So what is LSVT big? It is the Lee Silverman voice treatment big therapy, and it's based on the principles for LSVT loud, which was first developed for PD patients in speech therapy, and their main focus is on amplitude. Now, LSVT big took that same concept and turned it into learning and training big by increasing movement amplitudes directed across limb motor systems, including through their gait patterns. They use it to treat bradykinesia, decrease postural control and awareness, decrease gait mechanics and stability, and decrease balance. And it targets the damaged basal ganglia through repetitive activation across motor regions in the brain that are involved in normal amplitude movements. And it can be implemented by any LSVT trained PT, OT, PTA, or OTA. Now, their goal is to teach patients to carry over and sustain bigger movements throughout their ADLs. This study chose to focus solely on stage 1 PD patients who could communicate in English, were able to attend a community LSVT big exercise class, and were willing to sign a consent form for this study. So they ended up with 9 participants, 5 females and 4 males, all of which were Caucasian. They ranged in age from 51 to 82 years of age, and no participant reported having any previous PT for their PD symptoms. They also noted that time from diagnosis to the start of this LSVT big study ranged from 2 months to 65 months, with the median time being 17 months from diagnosis to the start of this study. For the study, each participant was asked to complete a PD knowledge survey, which consisted of 4 questions to determine each participant's educational needs about PD. Then they used 4 primary outcome measures to measure and track the progress of each participant, which included gait speed with a timed 30-foot walk test, the Berg balance assessment, the FGA to assess motor function and predict falls, and the UPDRS to monitor and follow the progress of each participant's Parkinson's disease. They also used 2 secondary outcome measures, which included the Foursquare step test that measures the timed ability to step in multiple different directions, which they tested clockwise and counterclockwise. The other was the PDQ-39 questionnaire, which they used as a self-assessment rating tool to track each participant's thoughts about their changes in mobility. During the study, each participant completed 16 one-hour sessions of one-on-one training with a certified therapist. There were 4 sessions a week for 4 weeks. Each session combined sitting and standing, sustained multidirectional and functional movements. The participants were asked to complete each exercise at a 7 or higher effort on a 0 to 10 scale, or their bigness effort scale, which is actually a modified version of the Borg perceived exertion scale. They were also given all the information needed to take home in their LSVT Big Survival Guide. At the completion of the 16 sessions, each participant was asked to complete 2 LSVT Big community exercise classes a month for 3 months. All of the outcome measures were taken at baseline at the completion of the 16 sessions and 3 months following the completion of the 16 sessions. At the completion of the 16 sessions, 8 of the 9 participants achieved functional improvement in at least one of the primary outcome measures, and several participants actually hit the ceiling effect for several of the outcome measures used throughout this study, meaning that their baseline scores were so high that they ended up maxing out the scales with their gains, and that difference didn't meet the minimal clinically important difference to be recorded for the study. Also, 8 of the 9 participants managed to maintain the gains that they had achieved at the completion of the 16 sessions when their outcome measures were retaken 3 months later with little or no change to their performance. So, to determine the strength of research for this study, we see that each participant was contacted by phone once a week throughout the entire 4-month study to discuss compliance and identify any barriers to exercising routinely. Anybody who did identify barriers were provided with guidance in helping to overcome them. This study also used therapist modeling with tactile and visual cues in one-on-one sessions with each participant. This study wanted to take a more proactive approach by focusing on early intervention with PD patients before they become a fall risk or more impaired. And this study was actually just published a couple months ago. Additionally, this was the first study to ever focus solely on stage 1 PD patients, so more research is definitely needed to show whether routine exercise can slow the disease progression in this population. They did not screen the participants for cognitive deficits prior to the start of this study, and also they did not factor that the majority of stage 1 PD patients are still active in the community and their family roles, so 100% compliance throughout the entire 4 months of the study was difficult for several participants. And lastly, they did not compare their study to anything else. They had no control group for stage 1 PD patients not receiving any therapy, or at least another group receiving therapy, just not LSVT big therapy, to compare their results to. And here's the reference for my article.